Healthy skin is a journey and not a destination. So let's talk about how to get there. Let me introduce you to Dr. Sapna, Managing Director of Skin Lumina. She is a skilled dermatologist with 15 plus years of experience specializing in cosmetic dermatology. And she has more than a decade of experience in clinical research as principal investigator in various skin and hair trials globally. She has authored books and several publications in both national and international journals. So, Dr. Sapna, could you please tell a bit about yourself and your approach to skincare?
Thanks for introducing me, Abhishek. As you rightly said, healthy skin is always a journey and it's not a destination. It's about like how consistent caring and making the right choices every day. I really enjoy helping people understand their skin and find the best ways to keep it healthy and glowing.
Okay, that sounds great. So, what inspired you to do this podcast?
Dermatology is my passion. I constantly integrate the latest knowledge and technology in my practice. For me, I'm really excited to share some of these easy skincare tips and the hair care tips which help you to maintain your skin and hair better on your everyday basis.
So, let's start with the basics. What are the most common skin issues you see?
The most common skin issues which I see in everyday practice is your acne, pigmentation, bacterial infections, fungal infections, and even pigmentation issues. And most often asked these days are the anti-aging treatments. These are the most commonest few things which I have mentioned in the whole, which we see in our everyday practice.
Acne, it seems to hit at the worst times. So, how common is it really?
Now, when it comes to acne, most common age group is the teenage, but we also hear sometimes patients in their adulthood they come and ask like, we have had a clear skin, we have not had acne issues in our teenage, but now we have. So when if I have to tell you in a percentage wise, it's about like 60 to 70% is during the teenage because of the outburst of the hormonal thing. But nevertheless, you also see in the adults when it comes to a male female ratio, it could be like 25 to 30% of the women will have acne during their adulthood, and maybe a smaller percentage of 10 to 12% will the males have the acne.
That's a huge number. So, what about the conditions like eczema and dryness? Are they really as common as acne?
Definitely, eczema and dryness are like a huge topic. Now, dryness could be as simple as your dandruff, that is the scalp dermatitis, or it could be a fungal infection. And across the age, the like if you take the pediatric age group, it could be common like conditions like an atopic dermatitis, or in the Indian women, you see a lot of bindi dermatitis or your color, hair color, that's like an allergic contact dermatitis, or it could be a fragrance, or the severe forms like a psoriasis. So there is a varied range, and it's a very common condition. We see that.
So, let's talk about the treatments now. If someone comes to you with acne, how do you go about it?
And yeah, that involves like assessment of the skin. We take a little detailed history to understand what's causing the acne. Now, everything it's always about understanding the root cause and then going about it. It could be like with the history when we ask, they could have used some acne creams or a fairness cream most often. Where it has a steroid content in it, and that would have led to the acne itself, or it could be because of their lifestyle where their food habits could be more sugary and chocolates and dairy products in it, or they could have underlining issues like your PCOD where there the hormonal issues are the main cause for it. And it also could be because of the site. It's like most often when you see a forehead acne or a back acne, we suspect the seborrheic dermatitis, that is the increased scaling of the scalp. So it's always important to know a detailed history, their lifestyle, go to the root cause, and then plan the treatment for them accordingly.
So, what are some of the most common treatments you use for acne?
When it comes to acne, it's always a combination treatment. So it's always topical creams we use, and we also combine it with some oral medication, and also sometimes with some non-invasive procedures. It could be like your peels, it could be some skin rejuvenation treatments.
You just spoke about chemical peel. Can you explain that a bit more?
So when it comes to chemical peels for acne, so these peels are basically of varied variety. So it has different level of absorption, like your superficial layer, mid layer, and deep layer. So what it basically does is it reduces the sebum production, and it will also reduce the inflammatory process. That's how it acts on the acne and helps to reduce your acne per se. And chemical peels are also used for the lightening, like the post acne marks which you have. So for that, there is combination of your lactic, kojic, and niacinamide. So all these things work in different combination. One is to reduce the acne itself, and also to improve the marks part.
So, what high tech treatments do you perform at Skin Lumina?
Now, when it comes to technology, we always customize understanding the skin needs. Now, the topical creams, does it work? And now we are combined it with the peels. When we feel that this is not helping the patient, we need to do something more to help. That's where the technology comes. So we try to do the technology with for the acne with the blue light therapy. Now, blue light therapy, how does it function? Is it's a high intensity radiation at a particular frequency, which helps to kill the bacteria. Now, P. acne is a bacteria which causes the acne. So, when it works at decreasing the bacterial growth, there we attain a normal flora. And these are done in number of sessions. And we also combine it with skin rejuvenation treatments, because acne skin is slightly tricky, where you can have an oily skin, at the same time the person can have a dry skin. So we need to work on the oil glands, which gives you the pH correction and also controls and balances that oil production. And then coming to the pits, now we have taken care of the acne part is done, the marks part is done using the laser toning and everything. Now what about the scars part? So when you see a lot of people post acne, they have the pits and scars like that. So for that we use a fractional CO2 laser. Now, how this fractional CO2 laser works is like when you have a wound, when there is a collagen loss or the tissue loss, when the laser light hits at a particular frequency, then the collagen remodeling happens. So you see the pits as a socket, and as the collagen remodules, it resurfaces, and that's you have even tone or an even surface of the skin.
So, what makes these treatments so effective?
The treatments will be more effective only when you have a holistic approach. So we try to combine it with the topical creams, and when that we use the technology and address the root cause of it. And the most important thing, these treatments are like precise, fast, non-invasive, and a minimal downtime, so that you can do your everyday routine as usual.
So, let's run through a few FAQs. So, the first question is, does diet really affect acne?
Definitely, because there are a lot of studies which shows that intake sugars, your chocolates and dairy products can trigger acne breakouts.
Can pigmentation fade on its own?
To some extent, you can't say completely no, but then definitely it can't clear your face. Now you have to do with some topicals or do with peels or lasers.
So, what's one skincare tip you always give?
That's a difficult question on acne, but still, what I would definitely recommend is avoid doing random DIYs. Not always what you see on your online and YouTube works the same way as they show. And before applying any new product, always do a patch test. Take a little bit of the cream, apply it on the hand, and if you experience any kind of itching, redness, or erythema, just don't use it.
Thank you so much, doctor. That was really informative, and we are looking forward for the next episode.
Thank you, Abhishek. It was a pleasure sharing my knowledge, and I hope our listeners found the information helpful. See you all in the next episode, where we'll be addressing about the hair care problems. Take care.